History of renal transplantation and how it started. It was in 1954 when a 23-year-old male who was suffering from chronic nephritis and declared to have renal failure was admitted in Harvard Medical School, Boston. He was planned for renal transplant with his identical twin. This image of the patient and his identical twin. In the early 90s, attempts were going on for organ transplantation which were unsuccessful. In the 1902, they are attempting to transplant dog's own kidney to the carotid vessels, then subsequently xenotransplantation, then cadaveric transplantation from a head injury patient given to a recipient in the thigh, but the kidney was not functional. It was in 1954 the team with Joseph Murray have decided to go for this identical twin transplant to avoid any immunological incompatibility risk. So this is the famous statement by Murray just before the surgery. This is Dr. Joseph Murray, who's a plastic surgeon. And the world's first successful organ transplantation, that is kidney transplantation, occurred between the identical twin on December 23, 1954. This led to the beginning of the organ transplantation, that is kidney solid organ transplantation all over the world. This is another famous image when the surgery was going on between the identical twins, which was taken in Harvard Medical School. The surgery lasted for around 6 hours, and the patient, who was declared as ESRD, lived after the transplant around 8 more years. For the same, the plastic surgeon Joseph Murray received a Nobel Prize in 1990 and he died in 2012. Joseph Murray also wrote a book by the name Surgery of the Soul, Reflections on Your Curious Career. And in India, the first cadaver transplantation was done in KM Mumbai Hospital in 1965, and between two living donor and the recipient, it was done in CMC Vellore in 1971. After the successful transplantation of the kidney, subsequently the focus switched over to the immunosuppressive regimen. Initially, they were trying with total body radiation, but it was associated with a higher complication. Then in 1959, mercaptopurine was tried. Then subsequently, azathioprine in 1960. Cyclosporin came into use in 1978. Tacrolimus in 1987. And also pre-transplant cross-match was also came into picture from 1966 onwards. This is